back to the channel. It's your girl ALEXISNP. What's up, what's up? If you are new here, thank you so much for stopping by and tuning in. Please go ahead, hit that subscribe button while you're here. Give this video a thumbs up as well. And if you're returning, thank you so much for coming back. So as you all have already seen, I started my morning routine. Washed my face, brushed my teeth, came down here, made me a little bit of something to eat. Usually I like to start off with some form of exercise throughout the day. So whether it's strength training or a daily walk, today would be a daily walk, but do some form of movement for the body. And then I also like to start off my day with a Magic Mind productivity shot. I love these little shots. I have worked with them in the past and I really enjoyed the experience as far as keeping me focused throughout the day. I'm not a big coffee drinker. I'm more so of a tea drinker. And so with something like this, it's easily digestible. It has naturally released caffeine from nootropics. So it contains L-theanine, lion's mane, as well as ashwagandha. So all of those things are targeted towards keeping you focused and keeping your stress levels at bay, because that's most important throughout the day. Like as a provider, yes, we're gonna come into different stressful situations, but we need something to kind of manage that. Magic Mind was nice enough to leave us a code for my special followers. So use code ALEXISNP for your first month free plus 20% off. So that's gonna bring you to like a total of 75% off. Hello, there is a steal when it comes to these productivity shots. So make sure you use code ALEXISNP. I will leave it in the description box. So click the link below for sure to go ahead and sign up. It's 2024, okay? We've already made our New Year's resolutions. It's time to level up. It's time to be more productive, disciplined, creative, and to remain focused and stress-free. So go ahead, sign up down below and get you some. Hello, how are you? I'm doing well, thank you. Can I get you to verify your name and date of birth, please? Perfect. And what state are you currently located in? The lisinopril 10 milligrams. For medication refills, especially with blood pressure meds, you always want to assess what are their average at-home readings just to make sure that it is below the threshold of 140/90 and to make sure that they are not experiencing any side effects from the blood pressure medications. Also, use this time to ask them when was the last set of their blood work or labs, just so that way we can make sure renal function is in good standing. And how can I help you for today? For urinary tract infections, the first thing that I like to assess for is the first day of the last menses, if it's a woman, as well as if she is pregnant or breastfeeding. And then secondly, making sure the last unprotected sexual encounter is listed, just so that rules out any chances of STIs or STDs. Next, I like to follow up to be sure that the patient is not experiencing any systemic symptoms, meaning fevers, chills, nausea, vomiting, or blood and urine. And if they are, I refer them to the ER immediately to be seen. If there are no drug interactions and the UTI seems uncomplicated, I proceed with oral antibiotic treatment and I instruct them to increase their daily water intake. I also let them know that they can use over-the-counter Tylenol or ibuprofen to help out with their symptoms when it comes to pain relief, and to follow up within 2 to 3 days. Yeah, Yeah, we'll go over. So first, let me know, when was your symptom onset date, and then what are you experiencing when it comes to symptoms? Paxlovid eligibility requires you to have a high-risk comorbidity in order to be approved to receive the antiviral prescription to treat COVID-19 or help reduce the severity of the virus. And so some of those comorbidities may be diabetes, cardiovascular disease, depression, anxiety, obesity, just to name a few. If criteria is met to receive the antiviral prescription, I do proceed with treatment in addition to symptomatic management with cough suppressants, saline nasal sprays, as well as Tylenols for fevers or pain. These patients are encouraged to drink plenty of water and daily fluids, as well as with electrolytes in the form of Pedialyte or Gatorade, and to get plenty of rest. Per CDC guidelines, the patients are to quarantine for 5 days from symptom onset date. Okay, so do you have a discharge with the odor at all? Bacterial vaginosis is usually caused by an imbalanced vaginal pH. Use this time to educate the patient to begin an over-the-counter probiotic supplement and to assess if they are using any fragrance or scented items like soaps, detergents, or fabric softeners. Also, educate the patient about assessing the hygiene of their partner who they are sexually active with. No, because we've already joined the call. Where are the hives? It is very important to assess if the patient is experiencing any form of respiratory distress, and if they are, they should be seen in person and not via telehealth. So I would recommend that they be seen with the emergency room immediately. If no distress is suspected, we can proceed with an antihistamine to help out with the itching, a topical corticosteroid cream, as well as some Aveeno oatmeal bath soaks, and then Aquaphor just for moisturization.